because as we realized in the, the the first session, we really require to be innovative for us to be successful in entrepreneurship of the healthcare. So in this session, we are going to define and understand the concept of innovation. We are going to explain the need for innovation in addressing healthcare challenges. We are going to differentiate between incremental and disruptive innovation in healthcare. And then we are going to recognize the various drivers of innovation in healthcare, but also identify and explore different types of healthcare innovations. And then finally, we are also going to explain evaluation methods for healthcare innovations. So, innovation, like we had talked about yesterday, is the creation and implementation of new ideas that result in improved products, services, processes, or business models. So it is not just inventing something new or a product and you leave it there, but it also entails successfully
Sir, my hand
making
is
it
up.
available and
My
beneficial to
hand is up, sir.
others. So if you invent a product in healthcare, but you keep it to yourself and the people who are meant to use it do not access that product, then it is not considered to be an innovation. So innovation can be seen as a process with two key dimensions, where you first create, or what we are calling invention, and then you commercialize or exploit. That is when you involve in the end user, so that it can ultimately become an innovation, that that product is going to be used by the target user. So the difference between technology and innovation then becomes the fact that technology is application of knowledge to solve problems or create new things. But when we create those new things, like I said earlier, and we stay with them, we do not put them out there to be used, then they stop at being technology. So innovation is now the outcome of using this technology to create value, to create something that can be used by your target audience. Then, uh, so ultimately, technology becomes a tool, while innovation is the result of using that tool effectively to solve the problems that it was really made for. So healthcare innovations are very diverse, and I hope each and every one of us can really name an innovation in healthcare. But a few of them that we have put up include medical devices. Yesterday we were talking about those smartwatches that are able to monitor our heart rate, our saturation of oxygen. We also have prosthetics that are printed using that 3D technology, whereby you can have someone who was amputated or lost their hand due to an accident or any other traumatizing event, like a disease, end up getting something that is close to their hand. Okay, it is a 3D printed prosthetic, or perhaps if they lost their leg, they can also get this prosthetic that is 3D printed, and it is also part of the healthcare innovations that we have. Then we have minimally invasive surgical tools, which really um, make sure that the doctors who carry out surgery no longer have to cut a lot, uh, to cut those large incisions, or to make those large incisions in one's body to access the inside of the body, all those organs which are diseased. But they can just use these minimally invasive surgical tools, where they insert that surgical tool, which is having a camera, into someone's body, and then it can be able to show what is wrong, and then how it can be corrected without having to cut a wide surface area. Then in diagnostics, we have liquid biopsies, we have AI powered image analysis, And then in therapeutics, we have personalized medicine, like I was talking about yesterday, where these days medicine is developed according to uh, those personal characteristics. Okay, it is tailored to your individual characteristics, your genes, your environment, the environment that you're living in, so that it can be able to address the needs that you have. Then we have also innovations in digital health, including telehealth platforms that can enable patients to access consultations and prescriptions online. We have mobile health apps to monitor patients' health. We have delivery models which include value-based care, patient-centered care, integrated care networks. So all these are basically innovations that are focusing on improving healthcare delivery to the patient, okay? Improving that care and making it more personalized, having more value for the money that the patient is going to spend. Okay, gone are the days where we had those one size fits all models where patients are given whatever is in place. But these days we have personalized medicine, we have patient centered care, so that the patient really comes out when they are very satisfied with the healthcare that they have received. So, when we talk about categorizing innovations into push and pull, we are saying that sometimes innovations are determined by the needs of the users. What is the population in need of? Okay, is it a vaccine? Is it a hospital? Is it a pharmacy? So when an innovation is driven by the needs of the population or the user, or what is in the market, then it will be called a pull innovation. On the other hand, if it is driven by development of technology, advancement of technology, the trends in technology, then it is called a push innovation. So in that case, it is the innovator or these developers that are pushing this innovation onto the users. The users themselves have not called for it. Yes, in the end, they might like it, but it is not their idea. It is not what they really need. Okay. So we realize that push innovations, because they have not been solicited, or they are not in the mind of these users, they are not needed by these users at that time, they are risky to take on, okay? Because there may not be that clear demand of the new technology. While pull innovations are less risky, as they are always based on existing needs, like we have seen. So we can also categorize innovations in terms of them being incremental or radical. So incremental innovations are just small improvements to existing products. A very good example here is like I'll use one which is a bit far from health, like the way Apple does, the way it brings in small modifications in its iPhone each and every year. We know that each year in September on that Apple event, they always bring in a new iPhone. But basically, when you see it is always like the old iPhone, but with some few changes. So that will be an incremental innovation. They have changed basically nothing. They have changed. They haven't changed the original iPhone, but they have made slight improvements. So even in the hospital, if you have a hospital and maybe you make um, a mobile application where people can access consultations of from that hospital itself, but now online. It will be a small improvement, but you will not be targeting uh, new customers. You will still be targeting your customers are now using something that has been improved. Then in radical innovations, you now have a completely new product or service that creates new markets. So a radical innovation is seeking to tap into that market that maybe is not yet tapped to, or it is ignored, or sometimes it does not have a lot of money to pay for the service. So that radical innovation is completely new, and it creates those new markets. So incremental innovations are less risky because already there is that parent organization from which you are innovating now something uh, as an increase, basically, you know, a small improvement on the existing products. But when you are analyzing it further, you realize that they have less potential for growth, okay? Because there is nothing that is so different, okay? But radical innovations can be risky because we're not yet sure if it is going to really work, okay? But they have that potential for to be successful in case people like the idea, which is new, which is intriguing, or which is very interesting. Then it is always likely to really be successful. So radical innovations can also be compared to disruptive innovations. All these two, the radical and disruptive, exist. They both disrupt existing ways of working and can trigger wider system changes. But when you look at radical innovations, like we had said, they represent that significant degree of change. It is always enormous or big, often requiring completely new skills or approaches. So in radical innovation, an example being like robotic surgery. When robotic surgery was introduced, where doctors do not have to cut uh, a lot of surface area on the patient, but they can use those robots to really make small incisions and then go into the patient to access those diseased organs with the camera through a small incision. When it came into place, because it was really new, it necessitated new training of these surgeons, okay? So that is why we are calling it radical. It represents that significant degree of change. While in disruptive innovation, it is often simpler, more affordable solution that can appeal to new customer segments. For example, online consultations with physicians, or making healthcare more accessible can be a disruptive innovation in this case. Okay, so disruptive innovations try to look at how can we now tap into those markets that have not been tapped into, like if hospitals are really focusing on delivering care that is a bit expensive, and you come into this market and you deliver uh, a product that is cheaper and can be accessed and afforded by a vast group of people in the population, then you will have disrupted that market and you will have created what we are calling a disruptive innovation. So the common features of healthcare innovations include the fact that they often involve both technological advancements and changes in processes. So you have technological advancements on one end, but also you need to change the way you have been doing things for these innovations to be really to cause the desired effect. Okay, so the example is that implementing telemedicine requires not just the technology but also adaptations to workflows, staff trainings, and potentially regulations. Okay, so if you put in place telemedicine whereby people can access drugs, they can access consultations online. You need to train staff to use such platforms, okay? You need to train them to attend to these patients at any time. So there you have to adapt to the workflows. Then you also need to regulate which drugs can maybe be given online, because there are some drugs which have to be only given uh, when the patient is physically with a doctor. So there are always those regulations that are going to come into play when you're dealing with these healthcare innovations. Then also adjustments to work processes. Implementing any innovation often requires adjustments to how the work is done within the organization. And here we are also looking at training staff on the new technologies, adapting rules or protocols to accommodate new approaches, and allocating resources for the implementation. For example, if you are going to have these mobile applications from which patients can get this online consultation and care, then you need to allocate resources to that. You need to allocate resources to the development of that application. First of all, to the maintenance, to the administration, the repair of that software, and the devices that are going to be used. So all that needs resources, and it has to be it has to receive the attention that it deserves for us to have a better healthcare innovation. Then we have healthcare innovation requirements. Just a summary that we the innovations influence not just the technology used, but also broader systems like staff training and skills, regulations and policies, financial models, and resource allocation, and stakeholder involvement across different care sectors. So in those obsolete models, or those old models, sometimes there are some stakeholders that are neglected, those ICT people. But when you are going to innovate something that is ICT related, then they become a very key stakeholders in that kind of innovation. And now you have to make sure that they are always brought on board to give uh, insightful information and ideas for better decision making regarding that healthcare innovation. So, how can we innovate? Okay, now that we have understood what innovation is, the challenges that can be met in there, and also the requirements that are needed for innovation, how can we now do this that we are calling innovation in healthcare? So we have different models, or um, different ways of innovating, and we have some of them we highlighted uh, yesterday. Things like design thinking, you know, but now we are also going to focus on others like stage gate model. We have innovation rocket. We have fast fail, safe fail as another approach. We have diffusion of innovation, future future thinking, and then normalization of process. So in stage gate model, if you are to visualize it from this slide, I hope it is a bit clear to for us to see that as healthcare managers that are sitting in this class, if we are going to put up an innovation, we have to first look at the ideas based on the problems that are existing in the society, or or the population that we want to serve. We look at the ideas based on those problems. We then, after we have seen those ideas and the customer needs, then we are going now to scope and see which is the best idea. So before we scope, there is always that gate. So a gate in this model is basically like a trigger for you to decide which ideas should we go on with, which ones are the best, okay? Which ones can be really used to create the impact that we want, okay? If we have discovered that there is a problem of malaria in our population, which we can come up with ideas of indoor residual spraying. We can come up with prophylactic treatment using some of those prophylactic drugs. We can come up with distribution of mosquito nets. But remember, we have limited resources, okay? So before we think of the best idea that we could implement, we are triggered by that gate to say, wait a minute, which idea is now the best, or which ideas are the best. So then we can now move on after that gate. We go to scoping, where we filter out the best ideas, and then from that there is also another gate before we build a business case to really see the the those nitty-gritties of the business that we want to put in place, okay? That prototype that we are looking at, okay? So we build that business case, and then after that we look at product development, the representation of the real idea that we are now going. If we have now focused on maybe distributing nets as the best idea, how are we going to do it? We design what a prototype of how we are going to execute this idea. Then after that we test in the market. We can give a few people amongst the population that we are targeting, and then we see how they react to this product. Are they loving it or not? What are the problems that come? What are the challenges that are faced when using these mosquito nets that we have given to them? Then we can now improve on these mosquito nets so that what we deliver in the end will be liked by the entire population that we are focusing on, and that will be the full launch of the idea. So these gates are basically to show us, to trigger us to think again or to decide on which idea is the best and how can we make it really solve those problems that exist in the population. So it includes the concept generation, identifying the opportunities, then project assessment and selection, selecting the options which can satisfy a certain criteria. Then we have now developing, translating those concepts into the products or the prototypes that we can see from if uh, our business is going to work or not, and then we also use them to gather data and feedback about that product which we want to put into place. Then commercialization is now the launching and marketing of the new product. So like I said, those gates are really this cues or triggers to make decisions, and they help filter out ideas so that we have resources allocated to the best ideas, and we can maximally use the resources. Then we have innovation rocket, and innovation rocket is more of a criticizing model towards the stage gate model. So in this case, they are saying instead of focusing, or instead of having all ideas in the world about the problem that is being faced by the population, how about we have a vision of what we need to do? Okay, if we are going to reduce malaria, instead of focusing on all those ideas, how about we say we are going to reduce malaria through just distributing mosquito nets, so that we can focus on eliminating those large number of ideas and picking only the winner, which is trusted, and we are sure that it is going to work. Okay, so there you eliminate the competition for the best idea. And remember, if you're going to have these ideas, which are many, the people who have contributed the ideas really believe in them, and they will always negotiate that their idea should be taken up, and this can delay the innovation process. So in this case, we want to focus on evaluation of the ideas, and instead of improvement. Sorry. So the innovation rocket is illustrated right there, and it is starting from the right hand, that extreme right where we have the expander. You build the best ideas into winning mixes, and then you quickly get down to the best ideas, and then you generate lots of high quality ideas, and start with a clear vision. Okay, so this is where we are saying that instead of having all those many ideas, it is better to have that clear vision, which will tailor you to the best idea, which is going to be uh, essential in solving that problem in the population. Then another approach of innovation in healthcare is what we call fast fail, safe fail. So it is more practical, and it is more realistic in nature. That the key idea here is you create innovation through the process of experimentation, adaptation, evolution, using trial and error to produce a range of workable solutions in an increasing real world situation. So in this case, it is basically what most entrepreneurs in our setting do, that in experimentation you directly try out various variations or prototypes. When we talk about prototypes, maybe some of you might be confused, but those of us who are here yesterday, we say that the prototype is that minimum viable product, a representation of the final product that you want to put out there, because you do not want to put out a business or a venture in healthcare that you are not yet sure if it is going to work. You want to build something small, test it, gather feedback, and then build a better or bigger venture. So that small representation of the bigger of the bigger business is what we are calling the prototype. Okay, and then so in experimentation, we look at trying out that prototype and then indicating what works, rather than uh, focusing on perfecting. Then the other the other element of fast fail, safe fail is the safe fail experiment. And in this case, like I've just said, the ideas that are not useful should be tried and allowed to fail. For example, in the other example that I gave, of where you want to try and see whether malaria can be reduced through mosquito net distribution, through indoor residual spraying, or prophylaxis, that is giving drugs that prevent development of malaria. So in this case, in the safe fail, we are giving each idea a chance to be tried, and we do not roll out all these ideas in the entire population. We test them in in a contained population group, which might consist a few people that will be a representative of the entire population, and then we see if the idea is going to work or not. So that if it doesn't work, we have not spent a lot of money. Okay, we have not used a lot of resources which we could have diverted to the other idea which is going to work. Okay, then in first fail is we are looking at the ability to maneuver very quickly during the development phase, when companies realize that their innovation is not going right in the right way. So as an entrepreneur, you should be able to quickly uh, test these ideas and then move on. Do not dwell on one if it doesn't work. Okay, so you should be able to maneuver very quickly during this development phase, so that you can be able to see what works and what doesn't work, and you can put in place a scalable product, or a product at a greater scale for the entire population that you targeted at the first instance. Then diffusion of innovation. In this case, the curve, we recognize that the curve is not linear, or what we are saying is that we you cannot say that when I put in an innovation, I'm very sure I'm going to get the market. Okay, or there will be market for this innovation. We look at other factors that could affect your innovation apart from the market. Okay, so existence of only the market is not basically a guarantee of success in innovation, especially in the healthcare sector. So we also look at other factors like policies, regulations, and other economic factors that could be prevalent at that time. Okay, and could shape decisions about your innovation. So if you bring in an innovation which is good, but it is at the time when a country or that area is being hit by an economic turmoil or inflation, then there will be low chances of it succeeding. Okay, it is good, yes, but it is not at the right time. Okay, then if it is also against the policies that are running at that time, if it is against the regulations, then sometimes it might even not take shape. It might not even be granted the chance to be scaled up. Then we also have individuals and organizations as another factor. We for your innovation to work, these people, you have to focus on their behaviors, their attitudes, the skills, the needs, the relative advantage of your innovation compared to other innovations, how complex your innovation is, and the cost. Then how easy is it to be absorbed by those organizations that you are targeting, or the people that you are targeting, the culture, leadership, strategy, the vision. All those are very important aspects in diffusion or absorption of your innovation, or acceptance of your innovation. So Rogers identified 5 innovation-based factors that govern the rate of adoption and diffusion of any innovation. And this Rogers guy explored how these new ideas or technologies spread within social systems by defining the key principles that underlie diffusion of an innovation, which include innovation itself as an idea, a practice, or object perceived as new by an individual or a group. Then diffusion as the process by which the innovation spreads through communication channels over time. Okay, so when we talk about communication channels, we are looking at media, people themselves. How does the innovation spread through those channels? Okay, Are people willing to spread the message of your innovation or not? Which channels are you using? Are they the channels that can reach all the people that you are targeting or not? Then the social system, the group of individuals interacting with each other and sharing a common culture. This could be a community, it could be a workplace, it could be the entire population. So you have to also know the social system, because social systems have different norms, they have different values and beliefs, and these could influence whether your innovation is going to be welcome or not. So the five stages of adoption, according to Rogers Everett, include knowledge. In this case, individuals become aware of the innovation but lack full information of it. Okay. So if you're bringing in a telemedicine application or an application that enables users to access consultation of doctors in the comfort of their homes, in the first stage, people are going to be aware of that innovation but lack full information, perhaps of how it works, of the problems that come with it, of its cost. So they are not yet very sure about your innovation. Then in persuasion, individuals form an opinion about this innovation's usefulness, especially from those who have tried it out. So in this case, there is an opinion that is developed. Whether it is a good or bad opinion, it now depends on that social structure that these individuals belong to. Then the decision is step number three, according to Rogers, where individuals decide to adopt or reject the innovation. When, if it is good and they have been persuaded well, they think it is going to work and it is going to meet their needs, then they will adopt it most likely. But if it doesn't uh, augur well with their needs, it is expensive, and sometimes it is against their norms, beliefs, and other social system aspects, then they might reject it. So in that case, we go to the fourth stage of implementation, where individuals put the innovation into practice. Okay. And after they have put it into practice, we have the last step of confirmation, individuals reinforcing that decision and seeking information to strengthen it. So after they have accepted it and started to use it, they will seek more information so that they can really gain maximum results from this innovation. Okay. So factors that influence this diffusion include characteristics of the innovation. We talked about relative advantage earlier, where we are looking at the uniqueness of this innovation compared to the other innovations that are in place. Okay. Is your intervention cheap or more expensive than those innovations that are in place? Yes, right now we are having a lot of those telehealth apps, which allow people to get consultations. But if you are bringing in another telehealth app, we want to ask as users if it is going to be different, and how different is it? Is it cheaper? Is it fast to use? Is it user friendly? So that relative advantage is also a very big factor. Compatibility, complexibility, reliability, and observability. We are going to look at these aspects in the subsequent slides. Then characteristics of the individuals as another key factor of whether people adopt your innovation or not. In this case, we are looking at the knowledge of the people. How knowledgeable are they to use those apps that you are bringing in place? Okay. What are their attitudes towards technology if you are bringing in a technological innovation? what are their values, what are their needs in that case. Especially when we talk about needs, you might bring in something that is focusing on malaria when at that point the most important need is perhaps TB. So you want to focus on malaria, but this population is in dire need of TB services. So ultimately, your innovation will not serve to their needs. It will not be relevant in that case, okay? Then the social status, and another factor is the characteristics of the communication channels that you use. Are they credible or not? If you use a channel that people think has always delivered fake news, it has always delivered things that are not right, then it is basically common sense that people will not believe that even this innovation is going to be right. Okay. And how far does this communication channel through which you are talking about your innovation reach? If you are delivering this innovation to the entire country and you're using perhaps a radio station that only covers the city, then obviously it will not serve its required purpose. Okay. Then similarity to the individual, the communication channel should be similar to the individual. You cannot use only social media when you want to serve the entire population, which has older persons who might not be having access to this social media. Then we also have social system characteristics, like I said earlier. So the social system or the societies have different norms, they have different values, they have opinion leaders, they have power structures. Okay. So you have to take care of all these factors if you are bringing in an innovation and you need it to be adopted. Okay. So if you bring in an innovation that is not that is not in that is not in in line with perhaps a region that is dominating in a religion that is dominating in a certain area, then ultimately your innovation might not work. Okay. Then the key concepts here, like I had promised earlier to talk about them, include trialability, which is the degree to which an innovation may be experimented with prior to launch. So your innovation should be able to 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 embody that trait of being experimented with, so that you can gain feedback from it. You can get the necessary data that will help you to improve it before you launch it to the entire population. Then compatibility, in this case we are looking at the degree to which an innovation is consistent with the user's context, their values and experiences. Then observability, we are looking at the degree to which the innovation usage and impact are. Okay. So application of diffusion in innovation, we need this knowledge as future innovators in the healthcare, because it helps us to market new products and services. If we understand the concept of those communication channels that are supposed to be used, then we can ably market these new products or services that we are bringing in place as our innovations. Then it also helps to implement public health interventions. In public health, any intervention that we want to put in place has to be informed by those social systems that we talked about. The aspects of norms, beliefs, knowledge, practices that are prevalent in that society should always be looked at. Okay. If you are going to encourage people to eat maybe um, to eat meat, and you say that it is good to eat meat, and the kind of meat that you can eat include pork, and you are talking to a society that is dominated by Muslims, then people might even go away from that meeting. Okay, they might they might abandon that innovation altogether. So in public health interventions, it is very key to understand some of these aspects that will help you to diffuse or to enable your innovation to be adopted by the target population. Then spreading of educational technology and also promoting organizational change, because all these require you to look at aspects of social system um, social system characteristics like the norms, the beliefs, the attitudes, and all that we looked at. So, approaches to innovation, or how innovation is done, include normalization process theory, in which we understand how practices are enacted and how innovation is normalized. So in this case, we want to ask some few questions, like the question of do participants have a shared sense of its purpose, the innovation that you are bringing, do all participants believe that it is important or not in the normalization process theory? Those are the questions that we ask ourselves, okay? That does it have that clear purpose for all relevant participants? Is it clearly distinct from other interventions? Like we had said, that relative advantage is very important. Then we also look at complexity theory and system thinking, which views healthcare as a complex system with interconnected parts and emergent behavior. Then knowledge sharing and spreading, in which we want to share lessons learned and best practices to improve these innovations. Then incentivizing innovation by paying for performance or putting in place rewards for the best innovations, bringing in partnerships between the government and the private sector, so that we can leverage that expertise from the private sector to have a better innovative culture. So other approaches include design thinking, like we had looked at last night, where we said that this approach focuses on understanding the needs of end users by involving empathizing with users or putting on the user's shoes, okay, to understand the real needs of these users and then inventing the solutions tailored to those needs, okay. So it consists of 4 phases, including understanding the problem, defining it fully by breaking it down to its component parts, and then developing solutions which are holistic in nature. And these solutions will help you to put in place a very market fit solution or innovation that can address the needs of the population that you are targeting. So agility in this case, or the ability to move on quickly and be flexible, is very key for this method to be successful, because it allows flexibility as you move between the phases while considering the user perspectives. So the idea here is that we have to utilize the other method or the approach that we talked about earlier of the pool of the pool approach, that we do not have to push these innovations onto the users. The users themselves already know what they need, okay. If they are facing like I had mentioned earlier, if they are facing challenges to do with TB or tuberculosis, and you're pushing onto them an innovation that is related to malaria, then your innovation might not be successful. Okay, you need to put on their shoes and acknowledge their needs. That right now the problem is tuberculosis, and if I'm going to put in an innovation that is going to work, it must be related or in line with solving that problem of tuberculosis. So design thinking is in that nature. You understand the problem by putting on the shoes of the users of your intended innovation. You define it very well, you define the problem very well, then you develop the solution and you put in place that solution as an innovation. Obviously, for it to be complete, you have to first test the prototype and then you gather feedback. Then you can scale it up to the population that you are targeting. Then we have future thinking, which is agile innovation method that infuses organizations with an innovative spirit, and it encourages forward-looking strategies by anticipating trends, emerging technologies, and societal changes. For example, if you're to see the current wave of artificial intelligence, you can really uh, innovate in that area by using this future thinking. Okay, you can realize that in future we are going to be having uh, less of the humans doing data processing. So if you need to build an innovation, it should be related to something that can be powered by AI, because AI or artificial intelligence is now the the future. Okay, so everything that is powered by AI is going to be very highly demanded in the near future. So this future thinking is the one that helps us to stay ahead of the curve and helps us to identify new opportunities and adapt swiftly to evolving uh, or dynamic landscapes that are in the healthcare. Okay, because the healthcare, as we said, is a bit of a complex field that is always evolving. So you need to all to be uh, to keep on evolving as well, to move with the people who actually move ahead of the curve, so that you can anticipate what is coming and you put in place measures to go to put in place those innovations that can address the needs of this population. Then crowdsourcing as another approach involves tapping into collective intelligence by seeking input from diverse groups of people, whether employees, customers, or external contributors of a particular organization. So in this case, we recognize the essence or the importance of divergent thinking, that employees can tell you what to do. Okay, customers have a say in improving the services that they receive. Experts or external contributors can also give you an insight on how to improve your services or bring in an innovation. So when you crowdsource or get ideas from these people, then you can come up with a better innovation. Then hackathons, like we said yesterday, are intensive events which are always time limited, and in this case they are utilized to bring into place innovations in a very fast manner. Okay, you have one day, you're presented with a problem and you're told to develop a prototype which can be judged by a certain group of experts, and the best solution according to them is going to be either given a grant, rewarded, or taken up by the organization that has organized that hackathon. All right. So as we go on, we need to differentiate between players and customers. So we pose the question: are players the same as customers? And the answer is no. the players in healthcare innovation are not the same as customers. In healthcare, the patients are the customers. It's the patients that we are focusing on. They are the users of our services, okay? But remember, the decisions about adopting or implementing decisions or implementing these innovations are often made by others, including the doctors, the hospital in charges, the nurses, the hospital administrators, the policymakers. They are the ones who make decisions on whether to adopt or reject these innovations, and yet it should actually be the customers ideally. So this can be very difficult to get innovations adopted because the people who make the decisions may not have the same needs and priorities as the patients. Okay, that is well explained. So we had said earlier on that innovation in healthcare is unique, or you can say it is hard in a way, and this is because it is the healthcare system is a bit complex. It is not as straightforward or as clear as the other fields in which we aspire to innovate in. Okay, this does not mean that we should be scared as future entrepreneurs, but it means that we need to approach it cautiously. Okay, we need to look at it from all angles that it embodies. Okay, because it is a very complex system with many organizations involved, many professional bodies, many financial departments or segments, or what we are calling silos, and entrenched cultures, different cultures. For example, if you're to look at, sorry, if you're to look at the healthcare system of most countries, it always has those councils of nurses, it has councils of doctors, dentists, and these all have different cultures embedded in them. Okay, they have different norms of how they do things. So if you're going to bring in an innovation that is going to be used by these people, if you are bringing in an application, a mobile application or a telehealth application that is going to be used by all these people, you need to know their needs, their norms, their cultures in those different councils, the dentists, the doctors, the nurses, the midwives. Those segments can be a bit complex to understand, and and can hinder successful innovation in the healthcare. So the context of the healthcare system is complex with stakeholders, decision-making processes, and processes that are opaque or unclear, and it is always unclear of who the adopter is or the person responsible for adopting the innovation. It could be the doctor, it could be the nurse, it could be an organization, it could be a regulatory body like the National Health System, or sometimes the National Drug Authority in a country setting. So these complexities sometimes scare off potential entrepreneurs, but understanding them can help you navigate through these complex waters of healthcare and come up with a good innovation. Okay, so the other point about the healthcare being unique is that it is constantly evolving due to constant changes in its underlying science and the development of new technologies, and because policymakers like to tinker with its funding and institutional arrangements. Okay, so you might want to put in place a hospital at a time when the government was in charge of insuring or paying for the patients. Okay, so if you put in place that hospital and you're targeting to get that ready money from the government through the insurance policy of a particular country. And now the government all of a sudden through maybe the legislators changes the policy, and the people are going to be paying out of their pockets. So now that change can can be very grave to your business, okay, of that hospital or your innovation. So those constantly evolving changes, we are now talking about artificial intelligence. If you are having a hospital with staff that are a bit conservative and not willing to take on these innovations of artificial intelligence, then sometimes you might be left behind, okay? And you do not want that. So those constant changes here and there, we already talked about that robot surgery. If you are not willing to purchase these equipment for robot surgery, for robotic surgery, if you that means that you might lose some customers, okay? If you are not willing to take on this telehealth app, you are going to lose in the market, you are going to lose your market base. So all these changes in the healthcare make it a bit complex, unique, and sometimes you can say it is hard. Then it is also heavily regulated, and that makes it risk averse, meaning that it is hard for any entrepreneur to take a risk and be guaranteed of making it, okay? So taking a risk by trying something new does not necessarily go down well with healthcare managers, politicians, or patients, okay? So that is the problem with this healthcare sector, that sometimes you might put in place an innovation, and because of these regulations it is rejected. Take for instance the people who innovated DDT. This was a drug that was going to be used in spraying for mosquitoes, okay? But because of the regulations, it was discovered that this DDT was harmful to the human beings, okay? Yes, it would kill the mosquitoes, but in the end, it would also affect the human beings. So it was rejected, and it was actually abandoned in most of the countries into which it was supposed to take effect. So the entrepreneur in that case lost a lot of money, and they could have been weeded out of business. Okay. Then we also know that it is highly politicized. For example, if you know that the most rational option to improve services might be to close a hospital department so that you can um, divert those resources into other hospital departments which are working almost important. This can result in angry voters and anxious politicians, causing a lot of fracas. Okay, because of that the political bit in the healthcare. Since it is something that people consider to be a public good, they are so much entitled to receiving the services and demand that these services are received in quality and quantity. Then economics of the healthcare, where we look at the structure of the national healthcare system, who pays for the services? Is it the government? If it is the government, how often do they pay? Do you have to health workers getting their salaries in time? If it is in government hospitals, if it is insurance, how long does it take for them to process these payments? So all these sometimes can affect can affect the return of investment or the ROI of any innovation that you put in place. Okay, so as we near the end of this session, we need to talk about disruptive innovation in more detail. So disruptive innovation is that process, as we had highlighted earlier, by which a new product or service creates a new market and value network, eventually disrupting an existing market and value network. So disruptive innovations are often simpler, cheaper, and more accessible than existing products or services. They can appeal to a new set of customers or meet the needs of existing customers in a new way. For example, let's look at like the computer itself. In those old days when the computer was innovated, there used to be very big computers, the ones that are called they were called mainframe computers. In fact, those mainframe computers would always be as big as to fit in an entire room, a big room, one computer in an entire room, okay? But disruptive innovations now came into play and reduced these computers to desktops, laptops, mini laptops, and then we have smartphones, okay, where you can do basically almost everything that a computer can do in the comfort of your hand, okay? So that disruptive kind of innovation that is simpler, that can appeal to more people, okay, that is more accessible, is what we are talking about here. Okay, so disruptive innovation can be used to improve healthcare in a number of ways, including reducing the cost or creating new and more affordable products. Okay, making healthcare more accessible by making it easier for people to get the care they need, regardless of their location. So you can look at things like those telehealth apps. Okay, if you create that telehealth app whereby you link, like I was saying yesterday, you link people with their pharmacies. Instead of them traveling to the pharmacies, you can deliver this medication to their homes. Then you will have brought this service nearer to the people. Okay, you'll have addressed that convenience bit of business. Then making healthcare more effective by providing new tools and technologies that can help doctors and other healthcare providers diagnose and treat diseases more effectively. Here we look at examples like that minimally invasive surgery, okay, where doctors no longer have to cut a wide area on a patient, but they can use those cameras to go in and see what is wrong and repair what is wrong using a very simple incision, okay? Go in with that camera, it is able to show on the screen what is wrong, and then they can manage it very well. So the challenges of disruptive innovation in healthcare is that there may be resistance, especially from healthcare providers who feel threatened. An innovation, in most cases, it is always brought in place to challenge the status quo. So if we have been having people who are resistant to change, who are still stuck in the old ways, when you bring in that disruptive innovation, there will always be that resistance, okay? Then disruptive innovations may need to overcome regulatory hurdles before they can be widely adopted. In some cases, there are even no regulations at all for these disruptive innovations. So before they are even accepted, in some countries you find there is now a new law that is put in place to address such innovations. Okay, so when you have to wait for such a law to be passed and actualized, then it can be a challenge. Then they also raise a number of ethical considerations such as potential for increased inequality and the need to ensure that new technologies are used safe and used in a responsible manner. You We already talked about these robotic surgeries. Yes, they are very good and they minimize that invasiveness of these conventional surgeries, but how many can afford them? Okay, so the question of inequality comes in. So the factors that affect adoption of disruptive innovation now become organizational antecedents like the structure, the existing social structures, the norms, the values of a particular organization or social structure. The climate is the organization open to this experimentation. If we are talking about these minimally invasive surgeries using those those devices, is this hospital that we want to take this innovation to open to experimentation to use this? Are they risk taking so that they can take a risk with this innovation and maybe hope that they will get patients who will be willing to be operated uh, using these new devices or not? Then the past experience, and then appetite for failure or risk. Okay, as an entrepreneur, you need to have that appetite to take risk. Okay, it is only through risk that we can be successful as entrepreneurs. That appetite for failure, because it is through failure that you realize what you did wrong and you can be challenged to improve. Then organizational readiness for change, which has been talked about earlier, organizational culture, the norms, the values, and leadership style. So an organization that 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 values innovation ultimately will always be open to such innovations to come into play. These disruptive innovations, the ones that bring in very new products and seek to disrupt the market by 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 addressing those challenges that have been neglected, by focusing on those customers that have not been focused on earlier. Then if it is an organization that values that innovation, it will always be open to allow this disruptive innovation in it. Then other factors that influence adoption of an innovation include how the organization is structured. Does it have a bottom-up structure whereby it allows people, the employees, to contribute without any fear, or it is vertical in nature, that it is the top people who are always having that final say? Then we have pre-existing social structures, like I talked about, the norms, the beliefs, and the practices. We have organizational climate, openness to experimentation or risk taking. We have organizational readiness for change. We have the norms and values, and then the ability and to absorb and apply knowledge from outside. So sometimes the organization might be willing, but it doesn't have the required human resource to put in place this innovation. Okay, and that can mean that this disruptive innovation, or that innovation that you want to put into place, is not going to work, or is not going to be compatible in that organization. So the challenges that are faced in adoption of innovations include aligning inner and outer contexts. Okay, aligning your innovation, which is the outer context, with the inner context, or what has been there. is can be very challenging. Then the complexity of innovation and stakeholder involvement. Like I said, in the healthcare system, we are having a lot of stakeholders whose ideas and opinions need to be attended to so that you can have your innovation being adopted. Then the leadership style of of the organization that you want to innovate or put your product into. How is it structured? Is it a vertical organization whereby those top managers push onto the employees this innovation or anything, or it gathers ideas from each and every one? Okay, so all those are the challenges and other and many more. But now, as we conclude, we need to see how then can we evaluate whether our innovation in the healthcare is working or not. So we look at aspects of efficacy, and in this case, we assess the innovation's impact on health outcomes compared to the existing standards. We are not going to say that since the innovation was brought into play and many people used it, that means that the innovation is good. We want to look at we want to look further and see the health outcomes. Okay, if the innovation was supposed to reduce the deaths that are related to cancer when we use these robotic surgeries, then we want to see fewer deaths, okay, that are related to cancer. Those health outcomes is what we are calling the efficacy. Then in effectiveness, we evaluate the real world impact in various clinical settings. Then in safety, we are looking at determining the potential risks and adverse effects associated with the innovation. In healthcare, in the healthcare system, we need to take care of that. The safety bit of an innovation is something very key. Then cost effectiveness, like I had said yesterday, is where we analyze now the economic benefits of the intervention or the innovation vis-a-vis the cost compared to the alternatives. If you are bringing in this robotic surgery, how does it compare with the other conventional or the traditional surgery in terms of the benefit vis-a-vis the cost? Okay, does it cost a lot and yet the benefit is not as profound as or as different compared to the conventional one or not? Then we also look at ethical considerations. Your innovation should not impact negatively on data privacy or equity access, okay, because ethics is very important in healthcare. Then we also have other methods like clinical trials, which we highlighted about yesterday, where you have two groups. One gets the benefits of the innovation, the other doesn't get, and then you track them and see if the one that gets has a positive outcome compared to the other that doesn't get. Then we have observational studies where you collect data on real world use of to understand effectiveness and safety. You observe how people are using this innovation so that you can see if it is effective, if it is safe, if it addresses the needs of the people or not. Then we have cost benefit analysis, which are talked about earlier, ethical review, assessing the ethical implications to do with data protection, patient privacy, consent, then equity issues and justice. Then qualitative research is an evaluation method that explores those user experiences by looking at their perspectives, by looking at their attitudes towards your innovation. Okay, so all these methods can be used to assess whether a healthcare innovation is good or not. So in conclusion, we realize that innovation is a very key aspect of healthcare entrepreneurship. If we use innovation very well by taking care of the aspects, the complex aspects that are embodied in the healthcare system, then we can be successful entrepreneurs. So thank you so much for your time. I will receive some few questions from the members that have been able to stay with me. Any questions? William, are you there? Moses, are you there?
So yeah, so on my side, I just come when you're almost.